From some research I've done by looking at the literature, like the early Norwood scales, as well as what we know in recent years about cell lineage differentiation, where DHT sensitive hairs have different characteristics than more resistant ones, the idea that the type of hair loss pattern in androgenetic alopecia is likely a genetic feature in and of itself, like, say, someone's height or eye color seems to be very reasonable, and some features are more common than others. But in DUPA, it appears to be an aesthetic of sorts. I say this because all it looks like is a diffuse, unpatterned hair loss. There are many conditions like hyperprolactinemia, hypothyroidism, and even some forms of areata, like alopecia areata incognita, that can manifest a DUPA-like condition, aside from androgenetic alopecia. That being said, have you ever recommended scalp biopsies in your practice when it comes to more atypical patterns of hair loss?
Yes, Dr. Robert Bernstein and Dr. Christine Shaver in New York. Dr. Shaver she's a dermatologist, and she had a particular interest in something called Lichen Planopilaris, which is another disease of the scalp that causes hair loss. There are a series of diseases of the scalp that cause hair loss, and you don't want to do surgery, hair transplant on people that have fronting fibrosing alopecia or Lichen Planopilaris or a variety of these other scarring alopecias. So she has made a habit of starting to biopsy young men in two places when she has even a suspicion that there might be some underlying disease, even though it doesn't show very well. And she has found an enormous number of patients have Lichen Planopilaris, which means that these people, if they had a hair transplant, will fail. Eventually, sooner or later, will lose their hair. So when we look at, I look at my career now 34 years in the hair transplant business, and I used to see every once in a while a patient would come in 10 years out, 7 years out. I even remember somebody 3 years out that came to me and he had a beautiful head of hair after the surgery. And then all of a sudden the hair started to fall out. And I always used to think of the hair around the side and back as permanent. It never went away. But at that time, I didn't understand that these people probably had Lichen Planopilaris and had this autoimmune disease in the scalp. And it was just inactive. And then as they got older, it became active. We find these diseases far more common in women than men. And for that reason, because they're so common in women, the doctors haven't thought of this as a male disease. And yet it is a male disease. And Dr. Saber is basically writing this up now for publication. So I think that this is an important observation. And so to answer the question, you make bad diagnosis.
I see.
I think if I'm suspicious of something, I'll biopsy it.
From what I see on websites like Reddit, people often suspect that they may not only have androgenic alopecia. And because not everyone is getting a biopsy, it could be the case that issues like Lichen Planopilaris and other conditions are often overlooked.
The problem in the hair transplant industry, and I don't mean to be too accusatory, but there are many doctors that enter this business that just learn how to do FUE and they don't learn dermatology of the scalp. And if they don't learn dermatology of the scalp and the diseases of the scalp, then they're going to not recognize these diseases, and then they're going to transplant these people as they develop balding, and then they're going to fail maybe 3 or 5 years later.
Yeah.
And when they failed in my hands down the road, and this, by the way, in my practice, the numbers that would fail were about 3% that would fail out there in 5, 10, 15 years later. But I'm sure that those 3% were Lichen Planopilaris, and a diagnosis that was never made. And by the way, nobody knew about it then. It wasn't like I was just a bad doctor. Nobody had talked about it. It was never considered a disease of men. And sure as hell it is.